is the more common, not common, we call it the classical approach. That's how they used to do it all the time, is going right in between the spinous process right in here, okay, to access the epidural space there. The more common one that we do now is called a transforaminal approach. Okay, a transforaminal approach allows us to target specifically the nerve that's causing that problem. See, when we do it out here, let me show you something. When we do a midline approach, the reason we don't do many midline approaches anymore is because the problem is here. The problem is here in the front, right? If I go in there and I inject back here, it's hard for that medication to kind of go into that front region. So sometimes you end up buying yourself 2 injections, 3 injections before it actually gets to that point. That's why you've heard of a series of 3 injections. It's because of that. So now instead of going in here, we bypass that and we go right there, right? And a lot of times you can get away with 1 injection. Sometimes you may need a second. The last way of doing things is right in here. This is called the Caudal Approach. So the Caudal Approach, this is the sacrum. This is what you're sitting on. This is where the gluteal region is, right in here. And there's a little opening in the sacrum, close to the tailbone. And what we do is we go in with a very thin needle, and we go right into that opening, and we shoot the medication upwards, this way. This is a good technique for patients that have had surgery, right? So if you have all these fusions up in here, nastiness, you don't want someone going in there and trying to, going through the scar tissue. It's very difficult, and you don't want anyone doing that. So what you do is you bypass all this mess, and you go right down here, and you shoot it upwards, right? So that's called a caudal. Also, with severe spinal stenosis, when patients have severe spinal stenosis and there's a lot of arthritis and it's hard to get in, it's a lot easier and better to do this caudal epidural approach. Now, usually with these injections, everyone asks, how long do these last? This is not a cure. Remember, we were talking about chronic pain. Chronic pain, you can't cure chronic pain. You can only treat it, right? So the typical answer to how long these usually last is anywhere between 3 to 6 months. That's the typical answer, because cortisone, usually that's the half-life of the steroid, of the cortisone. But you get patients that get a year and a half, and then you also get patients that only get about a month or 6 weeks. And then in those patients, you have to really consider doing other options.